Tell
Mm.
us what's going on with men's health nowadays.
Well, the best data we have for men's health is coming from America. So I'm going to talk to you about American data, although it's broadly the same across other societies in the West, including the UK. But yeah, I mean, people use women's health as a barometer for so-called the patriarchy oppressing women. But I mean, if you look at the actual outcomes, it's actually men now in America that are falling behind and have fallen behind for decades. So the facts are, men lead in 13 of the top 15 causes of death. They're behind. They're in terms of health outcomes, they're behind in every single racial, ethnic, socio-economic group. They die at 1.4 times the rate as women overall. And they live less life in every single country in the world, not just America, but literally every single country a man can live is expecting to live less life than women. So less life, more likely to die at every age group, worse health outcomes across every single demographic group. And now being a man is the single largest demographic factor of early death. So that's the biggest thing that causes early death, being a male. And I know Randolph Neese, he's quoted as saying that if you could equalize male and female mortality rates, you'd actually do more good than curing cancer. So that's how serious it's gotten. So men's health outcomes are awful across the board in every age category, in every single racial, ethnic, and socioeconomic group, in every single country. And yet we're still not really talking about it. There's about 7 or 8 now federal offices in the American government to support and research women's health, which is excellent. But there's not a single one for men and boys, not one governmental department for men and boys' health in America. But 7 or 8, I think there's 8 now. Biden's just added a new one, the White House Commission of Women and Girls' Health. But that doesn't sound very patriarchal to me. Like if men are leading in 13 of the top 15 causes of death in America, and yet there is no actual dedicated funding for their health, how is that a patriarchy? The same in the UK. It's not so different, but men's health is dreadful, and of course, the biggest risk to life for any young man, is suicide, and obviously that's a massive epidemic and deserving of a conversation in its own right.
Yeah, I mean, I know that there are some organizations that are starting to do some work specifically in the UK and in States to actually bring some public interest to the issue. But it seems to be a slow burner of the project. It isn't posh. It isn't going to score you like cards on. It isn't to score you a lot of cheap likes on TikTok, for example, or on Instagram,
No.
if you are going to be going on about the men's rights, because I would imagine 20 to 15%, 15 to 20% of the comments are going to be, well, what about women, blah, blah, blah. But there is an interesting sort of theme, especially in health, because we can see it like really, really well. When you look at your advocacy, I suppose, let's call it that, when you look at your advocacy, are you trying to level the field on the opportunity front, or are you trying to level the field on the outcome front?
Normally opportunity. I mean, I'm definitely a believer in equal opportunity. Just because you're afforded the same opportunities doesn't mean you deserve equal success. So in terms of equal outcomes, and I'm not expecting men and women to be sort of represented in every single level of society in equal numbers at all. Like I don't think men and women are the same in that way. But when I see 7 or 8 different federal government departments for women's health, then I expect to see the same for men and boys.
Yeah.
I don't want more or less. There's only a few areas where I'm actually pro equality of outcome. Overall, I'm massively pro equality of opportunity.
I think what's really interesting there is you've actually made a distinction between different. We should be having an honest discussion about whether we are actually where we are trying to sort of level the field. So, for example, sort of going back to the health, right? We know that men across all societies live shorter lives. Now, there has been some arguments made that biologically speaking, men are way more expensive to run. So your systems essentially, because you're bigger, stronger, blah, 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 your systems would be subjected to way more wear and tear. And women, for example, our immune systems are stronger. So, but there is this whole it's a funny sort of system to get right, because I don't think that we can agree that blanket equal opportunity is always going to deliver a system that we feel it's fair. To have really equal opportunities for men and women to have, for example, their specific sort of biological needs understood, we would need to have unequal funding. And the reason for that is women are three types of beasts depending on where we are in our cycle. And the book of Sarah Hill, that was talking about your brain on the pill, just absolutely blew my mind about it. Part of the reason why there isn't as much research done on women isn't patriarchy, it's just because we are actually very, very expensive to study, because the hormones change everything about how we react. So straight away, to even get to equal opportunities, we would need to have unequal funding. But at least then we would have an opportunity to have a level outcome. And even then, we might not be able to get there ideally if, as I spoken to like evolutionary biologists, and their I don't know whether it's a fact or whether it's a theory or whether it's a hypothesis, but that men are just more expensive to run. Like, you just sort of go through the wear and tear quicker. But I think the fact that we are not looking at that, that's the kind of problem, because nobody seems to be having like a nuanced discussion about what we can do with the limited resources we have to make sure that we can balance equal opportunities and equal outcome as much as we can.
Yeah, I mean, there is absolutely a significant biological element to why men live less life than women. Part of it's down to testosterone having sort of dampening effect on the immune system, and you're very right that women have a stronger immunity than men, which is one of the reasons why men died so much more from COVID. I think it's like men 1.6 times more likely to die from COVID, and 3 times more likely to go to ICU if they get COVID than women. So there's a biological element, partly testosterone, partly the XY chromosome. So obviously, not a complete second chromosome for men leaves them biologically vulnerable too. But that's not the entire gap, because the gap grows and shrinks over time. If it was just a biological thing, the gap would be the same every single year in every single country. But sometimes, I think the gap in life expectancy between men and women about 100 years ago was only a few years. Now it's like 4 or 5 years in the UK. So it's clearly a socialized element to it too. And there is, I mean, there's interesting studies in Germany, for example, after the war, there was a massive increase, I think, in life expectancy between men and women, like the difference. And yet there was a cloistered population of monks and nuns. 10,000 monks and nuns were basically cloistered in a part of Bavaria where they were just completely separated from society. So it was a really interesting opportunity to measure this biological side of the life expectancy gap, because you had 10,000 nuns, 10,000 monks living in a space completely separated from society. They're both living more or less the exact same lives, living the same lifestyle, working the same, living in the same area, eating the same food. And the gap between them was just 1 year. So it wasn't 4 years; it was just 1 year. So that's a really great way of understanding how big is the gap, the biological gap, and I reckon it's about 1 year. And it's impossible to deny that men live less life because of biology, but it's not as big as it is now. In some countries, especially in Eastern Europe, in Russia, for example, men can live 10 years less life than women. So there's no way that is entirely biological. So it's, as always, it's a bit of both. And yes, there are biological and sociological elements to it. And I would argue that even if it is biological, that isn't a good enough reason to just completely wash our hands of it. There are other groups. I mean, I'm a professional content creator. I work a lot of the National Health Service in the UK, and there are other groups that are biologically vulnerable to other diseases like diabetes and South Indian and Black populations. They're more vulnerable to diabetes. I work with those groups too, and I get paid money to help educate them and help reduce that problem. And at no point have we been like, well, they're just biologically more vulnerable, we're going to wash our hands of it and move on. Whether it's biological or sociological is to be debated. but neither of that is an excuse not to do anything, which is what we're currently doing.
Absolutely. But I like if we are even trying to sort of make a point that, you know, somehow we shouldn't be interested in men's rights because of women, we are completely forgetting about the fact that 99% of women are straight and they will have husbands, dads, brothers, sons, especially sons that and husbands that they will care an awful lot about. So leveling the field, or at least trying to do something to figure out what is it about the way that we are living our lives in Western societies that's so different from those monks, although we can probably point at few, and, you know, the education and all the downstream effects from that's been unfolding for the last 60 years. They will probably have something to do with it as well. But, you know, there should be some sort of action behind the idea that, or the pretense that we are trying to have equal opportunities, like that also includes men.
This sort of frustrating thing is, it's like, I don't have all the answers. Of course, I'm not qualified to have this conversation. I'm just a podcaster. I just have ideas and I just do research. I don't get paid for this. I'm not funded by anyone. This is just something I'm doing out of my own interest and goodwill. This should not, I mean, I'll be the first to say this isn't work that I should be doing. This is work that should be done by the government and funded bodies as part of an Office for Men's Health, or as part of a Minister for Men campaign, where these issues are investigated by qualified, funded individuals who can actually do the research properly, targeted research, dedicated research that understands why are men living less life. This shouldn't be some sort of hypothetical discussion between two people who, frankly, no offense, neither of us are qualified to have this discussion. And yet here we are, we're the best you've got. And I'm really sorry we're the best you've got, but our government is just not interested in learning more themselves, and they're not interested in putting money into it. Because it's not a vote winner.